Eyelid surgery is surgery that can be used either on the upper eyelids or the lower eyelids. It's commonly used to remove extra skin, to a lesser extent to remove excess fatty tissue that can accumulate beneath the eyelids, beneath the muscle, that can sometimes herniate, if you will, or bulge, creating a puffiness either in the upper or lower eyelids that for many women leaves them feeling tired or looking older than maybe what their chronologic or stated age is. The terminology for an eyelid surgery is technically called a blepharoplasty, but a blepharoplasty or an eyelid surgery can be performed in either the upper or the lower eyelids or both at the same time. Upper eyelid surgery is often a more subtle change. It's often used to remove just extra skin that accumulates in the upper eyelid. Some patients will actually have some small areas of bulging, particularly towards the nose, of fatty tissue that can bulge or herniate, if you will, from behind the eyelids, creating a puffiness in the upper eyelid. The scar itself rests right within the eyelid crease, so it's very difficult to see. Even when the eyes are closed, when the scar is most visible, it heals remarkably well. Of all the scars that we place on the body for different surgical procedures, the upper eyelid scar seems to be fairly forgiving and fairly discreet, meaning it's not well seen. Upper eyelids are often a procedure that will just allow a patient to look more refreshed. It can be very natural, it can be very subtle. It's often the patient who has this procedure that will have friends or others who will say, you look more rested, or have you been on vacation, because it really creates a freshened appearance to the upper eyelid. If upper eyelid surgery is being done by itself, in some instances, depending on what's being done, it can even be performed under a local anesthetic, meaning that there's no need for the patient to go to sleep. All of the sutures in the upper eyelid are removed approximately 5 days after the procedure itself, so the downtime from the upper eyelid procedure is relatively short, although some patients can experience some bruising that will persist even past a week or so. But in general, the upper eyelid is an area that can be treated in a very safe manner with a relatively short downtime, providing a freshened appearance to the upper eyelid appearance. Lower eyelid surgery is similar to upper eyelid surgery in that extra skin and fatty tissue can also be removed from the lower eyelids. In the lower eyelids, usually there's less skin being removed and more fatty tissue that is often present, creating a puffiness or a tired appearance in the lower eyelids. Lower eyelids also deserve a great degree more respect, both from a surgical standpoint as well as from an understanding standpoint as a patient, because lower eyelid surgery often can have a little bit longer recovery time period. The lower eyelid can often have laxity, meaning that the lower eyelid can have a little bit of a droopiness to it, that when an incision is placed, in this instance the incision is placed just beneath the eyelash margin, extending just out into the crow's feet, which are at the edges of the eyes. Sometimes that incision on an eyelid that has a little bit of droopiness to it or laxity can create a downward pull on the eyelid that necessitates or requires a procedure to be performed with the lower eyelid surgery, which is called a canthopexy or a canthoplasty, which is essentially just a tightening of the corner of the eye to lend support to the lower eyelid. But in essence, the lower eyelid surgery can help remove fatty tissue deposits that create puffiness while gently redraping the lower eyelid skin, creating a more freshened appearance to the lower eyelid region. Upper and lower eyelid surgery can be combined with other facial procedures often. It's not uncommon that women who are having concerns about their eyelid region also may have concerns about their face or their brow region. And particularly the upper brow or the forehead region is an area that can contribute to heaviness in the upper eyelid. A brow that is heavy or is downwardly displaced can create a full or droopy appearance to the upper eyelid, and so often or frequently women will seek a brow lifting procedure at the same time as an eyelid procedure. Similarly, there will be patients who may be concerned with aspects of their facial aging, and certainly a facelift or a neck lift or other facial procedures could be performed at the same time as an eyelid procedure. It's conceivable to perform other procedures of the breast or body at the same time as eyelid procedures, but typically we stage these operations separately. The most common procedure that's performed at the same time as an eyelid procedure is the brow lift procedure, which can be done either in an open technique with a scar that goes just in the hairline, or in an endoscopic or telescope approach where we make some very small incisions within the hair itself and insert a small camera that assists in moving and repositioning the brow at the same time as the eyelid procedure itself is performed. A good candidate for an eyelid procedure is a person who is concerned with extra skin or puffiness in the eyelid region, or who is bothered by just the chronologic aspects of aging, whether it be extra laxity in the eyes, damage by the sun, fine lines and wrinkles, or again, the puffiness that often plagues many people as we age, particularly in the lower eyelid region. These are often patients who are good candidates for an eyelid procedure, either upper, lower, or both. It is important to understand patients with other medical problems such as diabetes or other eye-related medical problems need to be certain that they tell their doctor about these conditions, as each of these conditions can affect whether a patient is a good candidate or not for these procedures. Patients who don't make adequate tears are also patients that we are cautious about performing eyelid surgeries on, but all of this in terms of information about the patient should come up during the course of the discussion with their surgeon, and if it doesn't, it certainly should be something that each patient is aware of and makes their surgeon aware of.